This medication, Clindamycin Phosphate Vial, is used to treat a wide variety of bacterial infections. It works by stopping the growth of bacteria. It treats only bacterial infections and will not work for viral infections such as the common cold or flu. It is important to only use this antibiotic when it is needed, as using it unnecessarily can cause it to not work for future infections. It should not be used to treat meningitis. It is important to follow the dosage instructions provided by your healthcare professional and take it at the optimal timing recommended. When using Clindamycin Phosphate Vial, the medication is administered through injection into a vein or muscle as prescribed by your doctor, usually 2 to 4 times a day. The dosage will be determined based on your medical condition and how you respond to treatment. For children, the dosage will also be based on their weight. If you are administering this medication to yourself at home, it's important to learn all of the preparation and usage instructions from your healthcare professional. Before using the medication, be sure to visually inspect the product for any particles or discoloration. If either of these are present, do not use the liquid. You should also learn how to store and discard medical supplies safely. It's important to use antibiotics at evenly spaced intervals to maintain a constant level of the medicine in your body. It's crucial to continue using this medication until you have finished the full prescribed amount, even if your symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your condition persists or worsens, be sure to inform your doctor. Some common side effects of Clindamycin Phosphate Vial include nausea, vomiting, metallic taste in the mouth, and pain at the injection site. If any of these side effects persist or worsen, it is important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, it is important to contact your doctor immediately if you experience any serious side effects such as persistent nausea or vomiting, pain or swelling at the injection site, dark urine, yellowing of the eyes or skin, easy bruising or bleeding, joint pain, irregular heartbeat, fainting, or signs of kidney problems. Long-term use of this medication may result in oral thrush or a new vaginal yeast infection. If you notice white patches in your mouth, changes in vaginal discharge, or any other new symptoms, it is important to contact your doctor. While a serious allergic reaction to this drug is rare, it is crucial to seek medical help right away if you experience symptoms such as fever, new or worsening lymph node swelling, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so if you experience any other effects not mentioned, it is important to contact your doctor or pharmacist. If you are in the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you are prescribed Clindamycin Phosphate Vial, it's important to be aware of the potential side effects. This medication has been known to rarely cause a severe intestinal condition due to a bacteria called C. difficile. This condition can occur weeks to months after treatment has stopped. If you experience symptoms such as diarrhea that doesn't stop, abdominal or stomach pain, cramping, or blood/mucus in your stool, it's crucial to inform your doctor right away. It's also important to note that if you have these symptoms, you should avoid using anti-diarrhea or opioid products as they may worsen the symptoms. It's essential to follow your doctor's instructions and report any concerning symptoms promptly. Before using clindamycin, make sure to inform your doctor or pharmacist if you have any allergies to clindamycin or lincomycin, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. It's also important to inform your doctor about your medical history, especially if you have kidney disease, liver disease, or stomach/bowel disease such as colitis. It's worth noting that clindamycin may affect the effectiveness of live bacterial vaccines, so make sure to inform your healthcare professional if you are using clindamycin before having any immunizations or vaccinations. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are an older adult, you may be more sensitive to the side effects of this medication, especially diarrhea. If you are pregnant, it's important to discuss with your doctor before using this medication. Additionally, this drug can pass into breast milk, so consult with your doctor before breastfeeding. Now let's talk about the uses and dosage of Clindamycin Phosphate Vial. This medication is used to treat a variety of bacterial infections. It is usually given by injection into a vein as directed by your doctor, usually every 6 to 8 hours. The dosage is based on your medical condition and response to treatment. It's important to use this medication regularly to get the most benefit from it. To help you remember, use it at the same times each day. It's also important to not stop or change the dosage of this medication without your doctor's approval. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential drug interactions. If someone has taken too much Clindamycin Phosphate Vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the US, you can contact your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center for assistance. Your doctor may perform lab or medical tests to monitor your kidney and liver function while you are using Clindamycin Phosphate Vial. Be sure to consult your doctor for more information. Make sure to take each dose of Clindamycin Phosphate Vial as directed by your doctor. If you happen to miss a dose, consult with your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. As for the daily dosage and timing, follow your doctor's instructions carefully to get the best results. Make sure to consult the product instructions and your pharmacist for the proper way to store Clindamycin Phosphate Vial. It's important to keep all medications out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless specifically instructed. Instead, dispose of it properly when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the correct way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.